Welcome everybody. This is Dr. Bolad, board certified physician in cardiology, interventional cardiology, and internal medicine. I am here to help you with all the information you need for your heart health and medical health, and informing you about all the latest treatments in cardiology and medicine. If you are new to this channel and would like to take great care of your heart, then definitely consider hitting the subscribe button and turning on the bell notification below so you don't miss any up-to-date information that emerges in cardiology and the medical field. Today, I'll be talking to you about angina, a very common heart disease symptom. So let's get started to learn about angina. What is angina? Angina, also known as angina pectoris, is the chest pain originating from the heart due to reduced blood flow to the heart muscle. Associated symptoms include shortness of breath, nausea, sweating, fatigue. If angina is suspected, quick diagnosis and treatment is necessary to treat the symptoms and also to reduce the risk of heart damage and death. Quick diagnosis is also necessary to rule out a heart attack. Angina is different from a heart attack. Angina occurs due to a blockage and reduced blood flow in the large coronary arteries, or to a spasm of the large coronary arteries. Blood flow is still maintained, although at a reduced rate. In a heart attack, blood flow is completely blocked and no flow of blood to the muscle of the heart, as shown here. Classic angina generally presents as a pressure, heaviness, or tightness in the center or the left side of the chest that is brought about by exertion and is relieved by rest. It is generally not described as pain or needles and pins. A few patients might present with angina equivalent, such as shortness of breath, nausea, sweating, and fatigue rather than chest discomfort. If you get any of these symptoms for the first time, then you should present to an acute care facility immediately if the symptoms are prolonged for more than 15 minutes. There are certain aspects of angina that I would like to discuss. Quality of the angina. Angina is usually characterized as chest discomfort rather than chest pain and might be characterized as squeezing, pressure-like, constriction-like, strangling, heartburn, fullness in the chest, band-like sensation, or knot in the center of the chest, lump in the throat, heavy weight on the chest, sometimes described as elephant sitting on the chest, or like a brow too tight, or even a toothache. Sometimes patients cannot qualify the nature of the discomfort and place their fist in the center of their chest. Angina is typically gradual in onset and gradually diminishes, with the intensity of the discomfort increasing and decreasing over several minutes. This is in contrast to non-cardiac chest pain, which is strongest in intensity at onset and has a quick offset. Location of angina. Angina is not felt in a specific spot and is usually a diffuse discomfort that might be difficult to pinpoint and might involve the entire chest. Angina often radiates to other parts of the body, including the upper abdomen, the shoulders, the upper arms, wrists, fingers, throat, lower jaw, and teeth, but not the upper jaw, and rarely to the back. The location and radiation of angina is generally the same each time it occurs. Provoking factors of angina. Angina is generally brought on by activities and situations that increase the heart muscle oxygen demand, including physical activity, emotional stress, and meals. Sometimes lying down brings the angina due to an increase in blood venous return to the heart, which results in an increase in the heart wall stress. Pain occurring after eating is generally considered to originate from the stomach. However, this can be a sign of angina. Timing. Angina occurs more commonly in the morning due to increased sympathetic nerve activity, raising the heart rate and blood pressure and increasing the vessel tone. Duration: angina is often relieved with termination of the provoking factor and generally lasts for 2 to 5 minutes, and it generally does not last for 20 to 30 minutes unless the patient is experiencing a heart attack. Patients who are known to have coronary artery narrowing get relief with nitroglycerin, which dilates the arteries and the veins. Diagnosis: the diagnosis of angina can often be made with a high likelihood based on the history, physical examination, and the electrocardiogram, and hence the importance of seeking medical help as soon as possible. Sometimes stress testing is necessary to verify the diagnosis with certainty when the history is not consistent with angina or in a high-risk patient with symptoms that are atypical for coronary blockage. If the stress test is positive or if the stress test is inconclusive, then we proceed with cardiac catheterization, in which we place tubes either from the groin or the wrists all the way up to the heart and inject contrast to look at the coronary arteries and diagnose whether or not there are blockages in these arteries. Treatment: when angina is diagnosed, the initial treatment would be aspirin. All patients diagnosed with coronary disease should receive low-dose aspirin. Relief of the angina symptoms, and this is achieved by the use of nitroglycerin, either through tablets placed under the tongue, swallowed, or through a drip if the patient is in the hospital. Starting a medication from the beta blockers family of medications. These tend to slow the heart rate, reduce the oxygen demand of the heart. Cholesterol-lowering medications from the statin family of medications such as simvastatin, atorvastatin, rosuvastatin, and others should also be started. If the symptoms persist, then we proceed with cardiac catheterization and possibly placing a stent in the blocked artery to relieve the blockage and improve the delivery of blood to the affected heart muscle segment. Sometimes there are multiple blockages or the blockages might be in critical positions. In this case, we proceed with open heart surgery and perform coronary artery bypass surgery. If you have any questions about what I presented to you today, or any cardiology question in general, then please subscribe to my channel and share your question in the comment section, and I will reply to you. If you have a question that you would not like to share in public, then subscribe to my channel and follow me on Twitter at Dr. Bolad, and you can send me a direct private Twitter message and I will reply to you. This is Dr. Bolad, helping you with your heart health. Thanks for watching and talk to you soon.